some probably good late evening to all. I welcome you on behalf of Malaria Consortium very much to take the time to participate in this project dissemination workshop. As you know, it's about a 2-year research project that Malaria Consortium did in Kampong Cham province in Cambodia. It ended early of May, so that's why we are now in COVID times doing this dissemination workshop on a tele mode, I would say. A sincere thanks to Tropical Disease Research funding from WHO and Dr. Bernadette, as the project was funded, including this dissemination workshop, by TDR, WHO, and it looks promising. The coming hour, most of you will enjoy the 2 presentations. So thanks, Bernadette, again. We also have Dr. GT with us, who is our Cambodian Malaria Consortium colleague, who was the project coordinator in Cambodia of this research project. So he's also available when questions are coming to give more insight on the project activities or the project site, if some of you would like to know. To close the introduction, because I'm not going to take it long, because there are interesting pieces to come. I think some practicalities, as most of you know. I would kindly request all the participants to put themselves on mute during presentations, just not to have interferences. If video allows, you can leave your video. The second one is this meeting, we intend and we will video record it. I think it's important for you to know, and that link will also be shared with all of you later on, including the entire presentations and the short movie. So don't worry, we will share all back to you once this workshop has been held. And then lastly, as you have seen, there's a large part of time dedicated for questions and answers and inputs, discussions, like 45 minutes at the end. Please feel free, we will give you the time either to put them in the Q&A chat box or either to raise your hand electronically, and then we'll try to get people voicing out inputs and questions after the 2 presentations. So yeah, I think that's all from my side. Once again, welcome all of you. It's a pleasure with this time zone differences to have so many people from the other side of the world and other continents. So thanks a lot for your commitments and participation. Before going to the first speaker, allow me to start with a short video of 3.5 minutes, which visualizes pretty well the project site and the project components, but in the mode of a video. And I think it's a good icebreaker if you want, starting up and preparing for the 2 more scientific presentations. So let's watch and listen to the movie, please.
ការចិញ្ចឹមត្រី7ពណ៌ពីមុនមកហើយមកដល់សប្តាហ៍ថ្ងៃនេះគឺត្រីនឹងនៅនឹងពីងអត់ដាច់ទេហើយបានដាក់ចំណីឲ្យស៊ីហើយនៅក្នុងនោះមានបុគ្គលិកខ្ញុំជួយសហការជាមួយខ្ញុំពេលដែលខ្ញុំមិននៅដាក់ចំណីឲ្យត្រីនឹងស៊ីបានរស់ហើយប្រជាជននៅក្នុងតាមខ្លងផ្ទះនោះគាត់បានមកយកត្រីមកស្រង់ត្រីនឹងដាក់ពីងបាទទៅតាមខ្លងផ្ទះរបស់គាត់ខ្ញុំណាងជាអាជ្ញាធរខ្ញុំបានទៅរៀនសិក្សាពី
Bồ mà bị khăn được cũng để trồng màu sập sai nó như bài này giống cứ tha bài dương chỉnh chấm có việc khát ở đây và tại bờ sân dương chấm có việc miền bị giàu đây và bao nhiêu bị giàu dòng bạch khi bị giàu dương tới những ai cắt và thao những cây thật nhưng trẻ thà xa mà nó chỉ lấy bông ôn này xong trong đây cũng sập sai đấy bởi bông ôn nào cũng chạm vào lắm cô mình giờ đây bông ôn nào mình chạm vào lắm cô hay từ nãy luôn sớm luôn chạm vào lắm thà con thấy đi mệt bị giàu thì cùng miền bị giàu mình giàu dân phun sắp sai kẹp tới tam con trai hôm nó ngồi trên chắp vô đã ăn như tới trên chừng nào làm bọc nhóm người châm cứ tham viên viên cháu ban nhân thái tòm
tới cò bàn trường nó thì đi còn còn làm giá là ao mưa cả có tới sầm an nơi kia kia là đến tới ao chui sắp sai nơi píกรุบตรงเชียดปียังปีกาสำอาดปากกาลูกสลามีกรมสาวสลาเนี่ยสำอาดชีพประจำปันมาสะอาดโอ้ดีนะเราสาจุดตาได้ทัวร์ปานตื้นกรมสาวได้ก็อาจพลิกยังไง
วันsinh nhật nhung với nhung đăng tam dạ khu ra qua ban dạy phép 2 năm muối đăng pi cả ăn sụp hơi đây cho bên là lại cho ta nâng 2 năm muối mà có cho phép tha ông pi lượng mua kla để tha vậy quạt mạnh nhận đại đã phải hay khu của ban dạy phép ông pi tháng bữa sinh nhật để ngày năng của đạo buông phong tử khai buông ca khai mua khang hai việc mạnh dễ tha bữa sinh nơi tiền dân miền lộc miền thập bọ Kampong thập bọ đông ấy đã đặt tắc ấy dân vô từ cọp chào từ hai bữa sinh miền lộc của dân cọp đi đặt lục bên từ hai bữa sinh tắc tiền quén bữa sinh miền từ tắc dân ảnh nạ bên trong năng lưu có đã thấy purple ở the sea
Thank you. I hope you enjoyed it. It's pretty much reality connected we thought to start this meeting. I would like to give the floor to our first speaker, which is Dr. Pierre Eschelbar. He's a consultant in social and environmental ecology and also adjunct professor at the university in Canada. So please, Dr. Pierre, go ahead with your very interesting presentation on the social aspects and the community engagement dynamics and achievements and strategies. Thanks, Pierre.
Well, thank you, Mark. Thank you, everyone. Let me start. Oh, maybe Tin, you want to let my video be, or should I just immediately share the screen? Okay, let me just share the screen, this one. Okay, so do you all see the PowerPoint presentation? Yes? Okay, so, well, as I said, thank you very much. Thank you very much, Mark, Leo, Bernadette, and everyone, all the partners, for this very fantastic project. I'm really, really thankful, grateful to have been able to participate and learn throughout the last 2 years. So, as you are well aware of, this project is entitled Impact of Social Ecological Systems and Resilience Based Strategies on Dengue Vector Control in School and Neighboring Household Communities in Cambodia. A long title reflecting indeed complexity and the hard work that has been put together to create a protocol that not only achieve good outcomes in terms of vector control, but also engage as sustainably as possible communities and local actors. So I'll go through the slides. It's relatively dense and rich, so I will skip some of the details, but as Mark and Leo said, the PowerPoint presentation will be available to all, so you can go back on the slides and look at the details if you want. And please also, anytime you have questions or I need to be clearer on some element, please raise your hands or intervene. Thank you. Okay, here. So you are well aware, everyone here in the audience, that dengue is a current important issue in Southeast Asia, in Cambodia in particular, as well as in the rest of the world. So I won't necessarily go through all the details here. Again, you can do that on your own. You are well aware of the significance of the issue. Note, for instance, that effective control of dengue is essentially and primarily done through smart, integrated vector control, right? This figure, and probably Leo will be able to comment on that better than I do, is just exemplifying or showcasing the latest outbreak numbers from 2019. So it just highlights the fact that dengue is still very, very significant, very, very important in its extent of a problem in Cambodia. And perhaps those these graphs highlight the limitations of the current interventions towards dengue control that are being performed. So it's just like this slide is about coming back or showcasing that there are like interventions that are currently and routinely implemented, but obviously with the current resurgence and outbreak that happened last year, and the continuing dengue problem, just it points to the fact that there are inherent difficulties, and that the current interventions led by government agencies or NGOs may be limited and not necessarily completely successful, obviously. Of course, this is the result of a certain number of challenges, including insecticide resistance that is growing, insecticide resistance to Temephos and Abat, resource and operational issues. That's perhaps the most important one, because this limitation in terms of time, personal, financial as well, limits and cascade into all sorts of subsequent issues and limit implementation and containment of dengue, simply put. So of course, educational programs are de facto accorded low priority. Strategies are not necessarily developed based on formative researches, that is, researches that include or help the voice of the local communities and local actors to be listened to or incorporated in implementation research. So I won't go through all of them. You are well aware of that. What I want to point to is that those challenges, I not highlight them to blame, but as a mean to highlight that those are levers, those are opportunities, and everything points toward the fact that engagement and building adaptive capacity at local level, engaging with local stakeholders, local actors, it's a low-cost, effective, grassroots, and potentially more sustainable way of addressing the dengue issue. And that's essentially what we intended to do during this project. So just one slide about the foundations, because the movie was fantastic, what we saw. It's what happened in the field, but all of that is the result of long reflections, long discussions, negotiation, understanding of key principles that are guiding action on the ground. So I just want to take a few minutes to go over what we used as a conceptual framework to guide our actions. So we use the so-called social ecological framework and resilient theory to guide really our actions. I won't spend too much time again on that graph in particular. If you are interested in that, of course, during the questions, we can continue discussing that. But essentially, you can see that to build adaptive capacity, that is, offer the skills and capacity to local communities to become the actors of their own decentralized vector control strategy, we need to implement a certain number of elements. Essentially, there are several legs, like the integration of various stakeholders, the integration of different worldviews or different capacities also. And you can think of the multiple layers of the society that have been involved in the mobilization in the context of the project, right? Different stakeholders, different representatives, villagers, school teachers, directors, ministry representatives, etc., etc. All those actors have different life experiences, have different worldviews, have different agendas. And so if we don't integrate those different agendas into the definition of the common problem, we may lack the capacity to achieve and to address sustainably the problem. So integration is really about merging worldviews, it's about enabling dialogue, essentially. And through that, you are better able to incorporate multiple elements of understanding, multiple factors contributing to an agreed upon problem. And so it contributes to identifying trade-offs and really redefining or defining really consensually the problem. This belongs to, this borrows to transdisciplinarity and system thinking. You may have used those terms. I won't spend too much time on that, but essentially, this is about integration, about establishing a common definition of a problem and working together to address it sustainably. And so, of course, once you achieve that, it leads to adaptive capacity and resilience, right? So all of that framework, again, I don't want to spend too much time, but I think it's important that the audience here today understand that there's been a tremendous work over the last decades on that. And a few senior colleagues here have been contributed really strongly to that elaboration of the framework. And so we stand on that. As an implementation research team, we stand on that wonderful foundation. And through that, and based on that, we identified both the primary and secondary outcomes, right, to be achieved during the project. Of course, the primary outcome was to reduce the dengue entomological risk, of course. But what this social ecological framework points to is that to achieve that, this primary outcome, we also need the contribution of the secondary outcome in terms of community participation, representation, involvement, partnership, genuine empowerment. And once you achieve that, those secondary outcomes, they will feed back onto the primary outcomes. And not only will we achieve dengue entomological risk reduction, but most importantly, we will achieve it sustainably. And this is really the contribution to that social ecological framework, really towards sustainable dengue control, not just dengue control now and maybe next year, right? So enough of that conceptual foundation. What it led to is, as the proposal and the protocol, is really the following objective. Is an RCT, a randomized control trial, to investigate whether a set of dengue-specific prevention in a fashion of integrated vector management associated to COMBI, so communication for behavioral impact, COMBI, health, empowering education, and community engagement, those combined with IVM, will significantly or not, but perhaps more importantly, sustainably, reduce dengue entomological indicators in rural schools and households in 2 districts in Cambodia. So that's the formal, official main objective of the project, which can be decomposed in 3 different specific ones. What we intended to is to really implement a multi-stakeholder driven, community-based, really strongly community-oriented, innovative approaches to really sustainably address the challenge of dengue. Especially, again, because in areas, in settings where resources and time and personnel are limited, we really do need to rely on the communities on the ground for them to become real actors, real contributors. And of course, as you will see just in a slide just after, we had 2 main components. One, end users, and the second one is social engagement element, to really adapt those tools that we know work but to adapt them to the local community context. And the second one, more precise, is to provide opportunities for research capacity building in Cambodia, and also to facilitate the uptake of new knowledge and research results through translation of research for best practice and influence on policies. So that's the claim, the objective of this project. So visually, it may be easier to grasp what we've done. So essentially, as you know, this is a randomized controlled trial with 3 arms, 2 intervention arms, arm 1 and arm 2, and arm 3 being the control arm. As you may have understood now, we had 2 sets of interventions. If you look at the left column, the column on the left, the bioenvironmental, which is essentially the biophysical tools being used to target mosquito populations. So we had 1, adult mosquito trapping, so traps essentially capturing adults, guppy fish distribution in containers in village and schools and health centers, solid waste management. And the second component related to community engagement, genuine empowerment in building adaptive capacity through 3 types of intervention: school, training and education, communication and behavioral change. So essentially the co-creation of communication material about dengue, and participatory epidemiology mapping. So altogether, so the first set of interventions, the bioenvironmental or biophysical, was implemented in the 2 intervention arms, arm 1 and arm 2, while the second set of intervention, more related to empowerment and adaptive capacity building, was implemented in arm 1 only. And so by comparing the outcomes between arm 1 and arm 2, you could assess the added value of the adaptive capacity building and community engagement strategies. Right about that. So that's the design of the trial. Again, strongly based on the social ecological systems and resilience strategy. So as perhaps T and Leo will further discuss, we implemented the project in the province of Kampong Cham in Cambodia. And just more detail about the primary vector control tools for this study. Of course, mosquito mass trapping using oviposition traps, and more on those in a moment. Using guppy fish in all containers, small and big, covers, as well as cleanup campaigns. Again, as you have now, I hope, understood, to implement these vector control tools and use them effectively and, more importantly, sustainably, we had to ensure a high level of community engagement. And I think this is perhaps the most valuable or the most important add-on to that of that study is to really focus on engagement and trying to understand the best modalities to do so. So here, let me take this opportunity to stress an important difference. And I'm not sure how familiar you are with the terms processes versus outcomes, but I'm sure this is critical to see really the added value of what we've been doing during the project. So often enough, we focus on outcomes of a project. What kind of achievement? It's about reduction in vector population or reduction in dengue incidence. Those are really end results, outcomes. But really what I think, and we think, is quite important, at least equivalently, if not more, is really how do we achieve that? Really the process of, for instance, engaging with the people that will be at the front line of dengue control. It's very important to differentiate the two and understand the value of looking at the processes. And because it's during the processes, well, it's through the processes that is the how do we engage, how do we achieve this and that transformation, including behavioral change and value creation happens. And only when a transformation and only when this happens, sustainable outcomes can be contemplated, can be achieved. So I really stress the importance of looking at the processes rather than just at the outcomes. and present in the next few slides the processes of community engagement. How did we manage to have the community involved, engaged, and really keen on contributing? That's key, because those people that have been keen on contributing following our engagement process will be the one continuing to act against dengue in the near future, even without us being here and probing or encouraging them to do so. So just in a nutshell, I won't spend too much time about the methods of engagement, because you will have a good taste of that when I describe the process and the achievements. So we did a bunch of school parent meetings held at 16 locations to discuss the education working strategy approach. So really bonding with parents, linking teachers, directors, and parents, students as well. Of course, key community stakeholders got involved in the discussion. We enabled a series of dialogues about the intervention setup and working system among key stakeholders. So this means what? This means that not just the community members and key stakeholders were informed of the interventions and agreeing on it, upon it, but they were also involved in its implementation, the problem definition, and also in the monitoring of it, and the monitoring and evaluation of its outcome in processes, which is, I think, a sign of community engagement and sustainable, community engagement. So again, we can come back onto the methodology used and the details, but for now, I think I will do. You'll get a grasp of that through the description of those key achievements. Mostly here for now, focusing on the process of engagement, while subsequently I'll describe more the outcomes of this engagement. So the next couple of slides will be focusing on how we did and what we ended up achieving, right? So please, again, let me know if you have any question, interrupt me if you feel like it. So first of all, a strong focus, as you may have understood, was on school, not just the teachers and the directors and members of the ministry, but also students. Students being encouraged to take part in the dengue education showcasing at community level, becoming agents of communication, sharing their knowledge, and therefore bearing responsibility. And so it was a way to include them into becoming actors and future leaders, perhaps, hopefully. So the objective of this school training program was to really enable teachers to acquire new learning teaching techniques, including hands-on experiential learning, which is, we know all as educators that hands-on learning, experiential learning is far more efficient than didactic textbook learning, right? So, and develop innovative teaching session, participatory teaching methodologies. We think that's one key innovation in our protocol, to offer opportunities for teachers to offer experiential learning opportunities to their students, and therefore create better learning opportunities. It is to be noted that prior to designing the school training program, training needs were assessed by designing specific questionnaires and leading a dedicated meeting with 2 school directors, 4 teachers, focus group discussions with 2 groups of students from 2 schools. So though the sample may be not as big as it could have been, the effort was to really ground our training program on the reality of the needs and the problems that the teachers are facing. The training needs assessment was used as a base for preparing both the training program, which was initially implemented to really get teachers and directors on board, and subsequently the revised curriculum on dengue, which is an important material that has been co-created in this project. Of course, after the training, there was a post-training in situ, that is real teaching action in school settings. So after this training and the revision of the existing curriculum, that what the revised curriculum that was created included a focus on hands-on workshops and experiments, and including the following thematic content. Of course, focusing on mosquito life cycles and breeding habitats, better understanding, better observing, knowing where they are, where they are to be found. dengue transmission characteristics, better understanding what this entails. Guppy fish life cycle, rearing and distribution. How, you know, and we will talk about that a little later in terms of establishing guppy banks at school settings, in health centers, in community settings. Predator-prey experiments to really see, like really witness how guppy fish can eat larvae and pupae. So it's a way to really, like, you always trust what you see. You don't necessarily always trust what you read about, right? Construction of traps following solid waste collection activities. And you can see that as a win-win situation. So the waste is being removed from the grounds, from the community settings, while you also reduce the likelihood for mosquitoes to breed. Cage experiments of mosquito release in trap, which also is a good school-based entomological surveillance activity and feeds back into the entomological component of the project. Trap monitoring, hands-on do-it-yourself demonstration of dengue teaching, the focus on preventing measures and tools, demonstration of how to perform weekly counts of mosquito caught in traps, demonstration of how to care of a sick child. So really this new curriculum was designed, co-designed, in order to capture the essence of the problem really more extensively than it was used to be. Of course, after the training, there was a significant increase in terms of knowledge and skills. But not only that, the teachers that were trained or receiving, were exposed to that new approach to teaching and engage with students, agreed on, and that's a commitment, right? That's one step towards being committed to act upon dengue with their means. So they committed to those 8 items: organizing dengue education in class, particularly on Thursday, as part of the regular life skill session in school. And you may realize that teachers are busy. Teachers are not necessarily, well paid. So it's quite a strong commitment. They perceive the added value of doing that. Second, perform dengue education before the national anthem on Monday. That's also a commitment. It's significant. Clean up our social campaigns in school organized every semester, May and at the beginning of the rainy season in November, at the start of the academic year. Clean up education for class and schoolyard. Drawing picture on dengue prevention measures to post on wall. Support and encourage students to care and maintain traps and guppy fishes both in school and in their community. Because we will see later on that the students, some of them at least, have been contributing to spread the understanding and knowledge about, not just knowledge, but also know-hows to the community. So as you can see, through those achievements, there's a commitment following the trainer and the mobilization of teachers and directors, a commitment towards acting effectively on dengue within the context of their, what they can do at school. Few additional details. So overall, about 200 teachers and school directors, 6 health centers chiefs participated in the training on dengue. They then later on trained their students and other teachers. About 3,400 students participated in about 600 health education sessions in classes over the 2-year period. 50 students from 16 schools were elected to present and share dengue knowledge, emphasize the severity of dengue, as well as showcase preventive measures to out-of-school peers in their community. Instruction lessons on guppy fish as dengue vector control tool was, and this is very important, it was integrated into the national health education curriculum of Ministry of Education, Youth and Sport in Cambodia. Huge achievement. The representative of Department of School Health of the MOEYS actively participated in a school training program. She acted as a facilitator of the training program and was provided with all training material. And in fact, it was really a pleasure to have her interact during our meeting, the last UPTEC meeting in Bangkok. We all remember her being around. So it was just really fantastic to see such a commitment, such an effort being harnessed towards achieving the goal of managing dengue sustainably. Few last words on the school training program, because I think I will be well over time otherwise. Okay, I can skip that. Just to be noted, there's one little drawback. During the last outbreak last year, there was some sort of miscommunication among ministry offices. This is important to be noted, because this is also an area where we need to continue our work to make sure that the different ministries understand each other and speak to each other, right? Because at that time, there was some operational inconsistency during the 2019 dengue outbreak. Distribution of ABAT was recommended by MOH when all the health centers and operational district officers nationwide were instructed to oversee the distribution of ABAT during the 2 months period. So it's somehow not necessarily aligning what we've been building with the MOYSH. But this is part of the challenges of linking so many stakeholders at so many different levels. So that's not necessarily surprising, but this is to be noted. So a few images on that school programs, see a lot of involvement, laughing, as well as, you know, seriousness about taking the role seriously from most of the kids and teachers and directors. Do you have any questions regarding that component, the school training program? If not, I will continue.
Yeah,
so together,
just to remind you, you have 10 minutes more.
Okay,
so please.
Okay. I will skip some slides then. So just mentioning the communication for behavioral change, the COMBI methods and social events. This was indeed complementary to what was done at school level. So again, I won't necessarily spend too much time now because I've consumed enough for now, but a lot of that community, school, parent, teachers joint meeting took place, and those strengthen the team vision, you know, among stakeholders, and really strongly contributed to success. So again, I will skip those details. Continuing, you can see that what was created together is real. Those leaflets, those posters, those banners have been distributed, led and explained by students during some community meetings. So again, the fact that the students led and explained some of this material to their community members is part of those process of engaging or supporting emancipation. And this is part of, you know, this is some of the objective of this project, genuinely empowering and, you know, decentralizing the capacity to cope with dengue. Of course, the community health workers were instrumental in this project. Again, numbers here you can read through. They significantly helped with linking between community members, schools, health centers, and of course, they led about 80 community-based health education sessions with a total of about 2,500 participating villagers. It is to be noted, and I think this is another attribute of sustainability, community engagement, adaptive capacity building, and resilience, that 60%, up to 60 to 80% of participants were women. So it really emphasized the key role that women leaders can play. And this is not to be overlooked. Another component was participatory epidemiology mapping. And so another way of engaging, another way of, you know, offering a forum for community members, stakeholders to speak out and to debate. So the mapping in particular was key to help villagers to spatially represent potential hotspots for breeding habitats. And indeed, the outcome being a map is good in itself, but also I cannot stress more the importance of the process of negotiating, of discussing the creation of that map, right? The maps created were used to inform the COMBI strategy, focusing communication in hotspot identified in the maps, but really people were able to discuss, adjust, and negotiate what they thought they knew before putting on the map. And so really this contributes to bringing a common vision and accepting, and therefore, accepting what the common solution will be subsequently. Here again, some images from those community mapping sessions. Again, you can see a lot of women involved, contributing to that. And I think that's really a good sign of success. That's what I said, gender consideration. Over 80% of women participated in PEM, participatory epidemiological mapping. Female social actors as village authority assistants and commune council for women and children got involved in the intervention activities and played the roles of facilitators in their communities. And also, as T can attest, a women group was associated or was involved in the fabrication of the homemade traps to be involved in the entomological intervention. And so again, this is a very hopeful message that those women groups took leadership in that. It's really going towards equity and sustainability, to my opinion. Okay, so more about the outcomes, more tangible end product that we achieved following the process of community engagement. So mosquito traps were produced. About 9,528 traps were produced and deployed in about 3,000 households in 20 intervention villages and 16 schools. I won't go through the detail. There were two types of traps, one medium-sized traps and small traps. Again, you can see from the images, those were made based on recycled material. Again, this is an important take-home message. We don't need expensive traps to be bought. We can find the material in our local community while getting rid of wastes. Of course, some side experiments we performed demonstrated that it's not yet optimal, but at least it's a step in the right direction, it seems. As I said, a women group from Chungkok village demonstrated an interest in being involved in trap making, and were trained to produce traps and produce about 2/3 of the total amount of traps. Subsequently, community health workers were also trained to produce the traps and distributed them in their villages. Regarding the traps, as I said, the design was not necessarily optimal, it seems. So we know where next we need to go, optimizing the design, following the villagers' indications. And also understanding that some of the difficulties and challenges in trap deployment was related to the fact that some villagers considered that it was not their responsibility to really take care of the traps. It was the responsibility of the community health workers or students that brought the traps. So there was some sort of difficulty here, but we noted it, we understood it, and that's taken into account for the next step. Just regarding guppy fish, a very important aspect of dengue control here in community-based dengue control in Cambodia in these settings during the project. A total of 26,000 guppy fish were distributed to guppy banks. And those banks were established in schools, 3 jars per school in 16 schools. At health centers, 20 jars were deployed, or 6 jars per health for the 20 health centers in the community, in the project implementation, and in communities as well. So you can see that an entire network of distribution was established quite successfully, and students and teachers could get guppies from the school, or if it was empty, or if they the population started to reduce, they could get them from the health centers or even from the communities. So really this distribution network was established and pretty functional. And of course, as you are well aware, guppies are well accepted in the communities in Cambodia. Again, I will skip some of the details and just showcase some of the photos, some of the action. In terms of feasibility and adherence, the guppy fish were really high highly ranked. So no major problems were found. In fact, most of the villagers appreciated, liked the guppies more than they did the abat, for example. Then an important, set of outcomes relate to social innovation and speaks to empowerment education again. So we just had our manuscript on social innovation accepted in infectious disease of poverty. I'm not sure if the editor-in-chief is present now. It would be really nice to have her feedback later on, perhaps. So as I mentioned initially, so it's good to have tools for vector control. We know they work, but it's better to have tools that are really contextualized, adapted to local community settings. And that's what we did through our process of community engagement, adapting the design of the traps or adapting the distribution of guppies to the local reality. And that's what contributes to sustainability. So the social innovation products that emerged following iterative consultation and sessions and meetings with community stakeholders are the following. So the adult mosquito traps that were made locally from solid waste collections, the revised dengue curriculum with hands-on activities for transformative learning towards ownership and further innovations, guppy distribution systems led by community members, co-design of dengue prevention communication material by students and community members, community mapping. All of that contribute to bring the actors, the community members that have been involved in the definition of those products. It brings them one step forward and cultivate the spirit of entrepreneurship. And when you cultivate that, it's one step forward towards building adaptive capacity and resilience. Yes, so building ownership, I won't spend too much time again. That's again the same spirit, the same causal link. So
yeah,
interesting.
Can I give you an additional 3 minutes and then wrap up if possible?
Okay, sounds good.
Thanks.
Okay, so as I said, building adaptive capacity and resilience. In the same vein, the type of health education we co-developed was really aligned with Frère, if you're aware of his work, empowerment education. It's not telling people what to do. It's really like digging into their potential and letting them express and explore their potential and manifest this potential into tangible action. So I think that's really one beautiful aspect of that project and its achievement. Okay, so just a note, and again, won't go too much into detail. We paid attention and we made an effort towards monitoring how much participation, how much empowerment has been achieved. So this spirogram, that stands on 5 different criteria. We've been assessing those criteria 3 times throughout the project, ending up with a fairly good score on all those criteria. We can come back to that particular one during the discussion or question period. Okay. So let me finish in summary. So local structural and know-how resources in school and community for dengue education and prevention were established. The steering support community for dengue control catalyzed multi-sectoral collaboration from the health, education, environment, and WASH sectors, as well as local authorities. The support, monitor, and provided, so the steering community supported, monitored, and provided guidance towards the elaboration of a contextualized strategy for dengue prevention and education. The school training program and the community health worker meetings and trainings on hands-on practical implementation tools and techniques was successfully established to build local adaptive capacity. The guppy fish rearing and distribution system was established and well-functioning. The implementation of the study contributed to sustained partnerships and linkages among different actors within schools and communities, as well as at higher levels within, all those ministry levels and district officers in charge of WASH, for example, and environment. So overall, the objective of enabling a multi-stakeholder, cross-sectorial, collaborative endeavor towards decentralized dengue control seems to be rather successful at this stage. Of course, continuing support is necessary, but those first steps are very promising. Thank you very much.
Thank you very much, Dr. Pierre. A very interesting presentation, and you've managed to finish it timely, so thanks a lot, Pierre.
Yes, thanks so much.
I retained 3 words from your presentation, and it's involvement, engagement, and genuine. And I think the way you presented the project aspects and achievements are reflecting how you presented it, but is also reflecting it all the way down to how the project is conceived or was conceived on community level. Of course, with the few Malaria Consortium staff, but with a great involvement of communities from subnational to extreme village level. So thanks a lot, Pierre. I will not allow the participants now for questions, but please write them down, and there will be place at 3:20 p.m. To have another 40 minutes of questions and answers, and Pierre will still be around, so please be a bit patient. Thanks, Pierre. Well done. Let me go to the second presenter, who is Dr. Leo Braak. He is the Malaria Consortium Senior Vector Control Specialist, and he's based in Bangkok in the Asian region, and he's giving support to multiple projects of Malaria Consortium, but is also active in regional networks in terms of vector control specialists. So Dr. Leo will present more the entomological aspects and achievements. Please welcome him. I would just like to ask Leo if there are some overlaps with some items that Pierre mentioned. I propose you skip them, except if you have more updated relevant figures. But let's not try to overlap and leave the space for questions and discussions afterwards. So the floor is yours, Leo. Thanks a lot.
Okay, thank you, Mark. I just want to check first, can you hear me?
Yes.
Mark, you can hear me? Okay, and you can see the video, you can see the presentation up on the screen?
Yep.
Can you see my cursor if I move the cursor, Mark?
Yes.
Okay, so thank you, Mark. And I feel I need to acknowledge Pierre for what I thought was a beautiful, very eloquent and very effective presentation. It was a real pleasure listening to that comprehensive description of the social engagement processes in the Kampong Cham project. So sincere thank you, Pierre, and very well done. I'm sure our participants enjoyed it as much as I did. So, okay, Pierre discussed the social side of the project. I'm going to give a more dry, concise, crisp presentation of the hard entomological science behind the project. I don't think I'm going to be all that long, but to remind ourselves that this project is about the use of a defined set of entomological tools, simple tools that anybody can use, and getting communities involved to implement those interventions, to see whether that set of simple tools, if implemented via community participation, if that is effective in achieving vector control. So that's basically what the project was all about. So although I'm presenting the presentation, how do I move on now? Okay. I need to acknowledge, and needs to be publicly said that this project, of course, wouldn't have been possible if it hadn't been for the input of multiple other people. And I'd like to, I think they deserve to be mentioned. So our project manager was T. Chia, supported by Soka and Srun. Wonderful team, very effective, very diligent. Thank you guys for your hard work. And then very ably supported by our previous country director in Cambodia, Yves Boni, and now our regional Asia director, Mark Debakara, also in Phnom Penh. Thank you to all of those people. And then Pierre, of course, who supported with the very effective guidance and supervision of the social engagement processes of the project. Jeffrey, he did the initial conceptualization. It was his idea, this project. He conceived the idea and refined it with the help of Bernadette at WHO, supported by John Husted. I need to acknowledge Jacob Biggio, who is an intern from London School of Hygiene and Tropical Medicine, came on board last year, and he did the analyses of the entomological survey, did the data analyses, and you will see all of that later during the presentation. Also, sincere thank you to Claudia Nieto, Kun Peters from the Institute of Tropical Medicine in Antwerp. And then I don't know how to thank the next two people because they went the extra mile. Dido Budi Prasetyo from Namru 2 in Phnom Penh, and Sambun Leng from CNM, two government and Namru representatives that spent weeks in the project area, microscopically identifying day after day after day after day adult mosquitoes and larvae and pupae for weeks on end. So to those two, deep, sincere thank you. Of course, the project would not have been possible if it hadn't been for the endorsement and support and active participation in many ways of our Cambodian government partners. And then really, the project would not have been possible if it wasn't for the buy-in, the support, the encouragement, and the friendly collaboration of Bernadette Ramirez from WHO TDR. So to all these people, very sincere thank you for your contributions, which made the success of the project possible. Pierre has already alluded to some of these issues. I think everybody in the audience is aware that dengue is a rapidly increasing disease globally. And dengue is I'd like to dwell on this for just a few seconds. It's important to note that dengue is transmitted mainly by two Aedes mosquitoes, Aedes aegypti and Aedes albopictus. These are day-biting mosquitoes. They don't. They bite mainly during the day, which is when bed nets don't really help you much. They're also known as container breeders, and they're very strongly affiliated with the humans, strongly attracted to humans, like biting, preferentially feed on humans, and they breed preferentially in small containers, empty tins and bottles and coconut husks, old tires, etc., lying around the household, collecting a bit of rainwater, and that's all they need, just a little handful of water, and they breed in there. And then also, very importantly, in these water storage tanks for holding water at the household. Asia records about 70% of the global dengue caseload, which is about 400 million per annum. So Cambodia is one of the highest per capita incident rates. More than 70,000 cases reported in Cambodia in 2019, an outbreak year. Children are disproportionately affected. There's no effective vaccine currently, no treatment drugs, high resistance to many insecticides. So we have to rely on vector control. I say all that as background to the way this project was structured. So again, just to show since dengue became really evident in the early 1950s to show you the very steep rise in global incidence of dengue. It is a growing threat globally. It's not going to stop. We have to start giving more attention to dengue and its sibling mosquito-borne infections that are transmitted by the same mosquitoes. Also Aedes aegypti and Aedes albopictus, transmitted by, that transmit Zika, chikungunya, and Cambodia has a problem with chikungunya this year as well. This slide that Pierre earlier showed, I'm not sure if you can see my cursor, the bottom green line shows the average number of cases per month over the past 5 years, 2014 to 2018. That's the average number of cases per month, the highest number in July, August. And then the big blue bars represent the outbreak year last year. So it's very episodic. You know, you get average trends, but then you get also these outbreak years occurring. So to mention again that this project was about 4 very specific vector control interventions implemented via communities. As Pierre pointed out, it depended on 2 elements, a social engagement element and a vector control element. So in agreement with WHO TDR, the overall bigger primary and secondary outcome success measures for evaluating dengue interventions in this project in Kampong Cham province were 2 things. The primary outcome, the single biggest indicator of success. How successful were the interventions implemented via communities in reducing the density of adult Aedes mosquitoes in the intervention arms of the project? That's our primary measure. There were some secondary measures that relate to various indices, and we'll get to each of them, that relate to the abundance of larvae and pupae and infected containers and so on. So these are the 2 primary indicators of success at the end of the day. Just to give you a sense of where the project took place, this is Cambodia, the map, Phnom Penh down here, Kampong Cham province next door, project area more or less here. To give you a sense of what the project area looks like, you've already got some idea from the video and some of Pierre's slides, but typically there's a street scene in a typical village setting, and then very typical, overwhelmingly wooden houses raised on stilts, many houses with some cattle associated with them. Some more slides to show you. Here's another one of those wooden houses raised on stilts against monsoon rains and mud and so on. The mother of the home with some children. Inside that building, that house, it's largely one big open space, slatted floors, wooden walls. If you've got a bit more disposable income, you can buy yourself a wooden bed, raise yourself off the floor with the mosquito net, and you can even afford an electric fan, which cools you down, but also helps to keep mosquitoes away, very importantly. Others just have a simple mat on the floor. You sleep on the mat with your mosquito net, again, slatted floors, wooden walls. Below the house, below here, either storage of farming implements or your livestock bed down in that area. But in many homes as well, it's an activity area where members of the household perform daily chores, sewing, or the children play around in the shade provided there. Kitchen area also, often in a corner below the house, or a separate little building for protection from wind and rain. Very basic, simple kitchen, typical there. in most of these rural villages, not just in Cambodia, but Myanmar, many other countries in the Greater Mekong sub-region, there's no piped water. So people have to collect water from wells, and then they store them in these big pots or jars that form excellent breeding sites for Aedes mosquitoes. Very good breeding areas for these Aedes mosquitoes. Some people use rainwater. They collect rainwater from the roof and keep them in these water containers. Adjoining the villages are expanses of rice fields, very typical setting as well. So Pierre has gone through this, just to mention again, 3 intervention arms. Arm 1, take note of this because we're going to refer to Arm 1, 2, and 3 repeatedly in the next few slides. Arm 1 is the experimental arm that has the full set of entomological tools plus full social engagement activities. So all the vector control tools were applied in this intervention arm, plus the social engagement, strong social engagement processes to ensure that they understand what to do and how to do it and maintain the use of those vector control interventions. Arm 1 was 9 schools and 10 villages. Arm 2, only the tools were provided with some basic initial guidance on the use and maintenance and continuation of those traps. Not much after that. That's 7 schools and 10 villages. Arm 3, it's obscured here by my picture now, but Arm 3, you might be able to see it better than me, but also a number of schools and 10 villages. So again, just to reiterate, mosquito mass trapping was these mosquito traps, homemade, self-made by a women's group in the community. 2 types, a small trap and a large or a medium-sized trap that the communities made themselves, 9,500 of them. 3 traps per household, 1 medium trap and 2 small traps per household in 3,158 households. Just to explain, I find it interesting, hopefully you'll find it interesting. There are various compartments to this trap. The bottom base holds some water. You have dry grass that you put inside the water, and it rots and it gives off a smell, an aroma that attracts the female Aedes mosquitoes to come and lay eggs in there. So the mosquitoes come through the top here. They can't actually reach the water because there's a mesh that prevents them from actually being able to lay their eggs. So they fly around inside here, and the sides of this top chamber has sticky paper around it. So they get stuck in the sticky paper, and then you can remove that at intervals once it gets filled with mosquitoes or dust and so on. Another major intervention was the use of these guppy fish, which are highly effective in feeding on mosquito larvae and pupae that develop inside these containers. So more than 26,000 guppy fish distributed to establish fish farms at schools, strategic places in the communities, very often at the village heads, homes of the village heads, and also at the community health centers. Those were the farms, call it if you want to call it that, for breeding of the guppy fish, and then school children could harvest the fish, and community members, and they can take the fish back to their homes to put in their own jars. And these fish are genuinely very effective in feeding on the mosquito larvae and pupae. Another intervention was advocating, encouraging people to use container covers, to cover any containers that did not have guppy fish in there. These were the minority. And then also cleanup campaigns to reduce empty tins, bottles, coconut husks, tires, etc., lying around that collect rainwater for mosquitoes to breeding. Yeah, this pictures are showing the women's group making traps that school children were taught how to use and how to maintain them and how to empty them and replenish the sticky paper. Yeah, they're taking them apart and reassembling them, learning how to use those traps. Very good method. But as Pierre pointed out, to implement these vector controls tools effectively and sustainably, you have to ensure a high level of community participation. Very, very important. So Pierre went through all of this. I'm not going to dwell on this. Pierre explained all of this, the different elements of social engagement to achieve social participation, commitment, and sustainability, various approaches, strategies, methods to strengthen that community participation and commitment to use these tools. So let's then move to, okay, how effective was all of this? Let's have a look. So bear with me, hang on. I hope you can read this. The font is slightly small, maybe. So we did intensive surveys every 6 months to monitor the impact of the interventions on the mosquito populations. Every 6 months, a 2-week intensive period of catching adult mosquitoes and doing larval collections in 600 households in the project area, 200 households randomly selected in each of the experimental arms. So it's 2-week survey periods every 6 months in 200 households per experimental arm. So if we look at this is the prime indicator of success, our main indicator of success, which is the mean number of adult female Aedes aegypti and Aedes albopictus, and it's mainly, overwhelmingly, Aedes aegypti per house. In August 2018, it was actually also February 2019, August 2019, and February 2020. So it's, this table reflects the reduction in the mean number of adult female mosquitoes per house. August 2018, arm 1 is 0.28 adult mosquitoes per household, and arm 2, 0.36 average per household, and in arm 3, the control arm, 0.39. No statistical difference, which is exactly what you want. This was the baseline survey. No interventions had been implemented yet. So you'd expect, and that's actually what you want, is that the numbers of mosquitoes are more or less equally distributed in abundance throughout the 3 intervention, or the 3 experimental arms. It was pretty much the same in February, because the interventions hadn't really kicked in yet. Then we come to August 2019, arm 1, where the full set of interventions were implemented, 0.34 to 0.6, arm 2, 0.46, arm 3, 0.72 to 1. Here you can see the intervention starting to kick in. Very significant difference between the 2 intervention arms and the control arm. By February of this year, earlier this year, in arm 1, where full interventions were implemented, 0.36 adults per household, arm 2, 0.27 adults per household, and in arm 3, the control arm, 1.3 per household. So a very strong reduction in mean adult density per household in the 2 intervention arms. So I don't think anybody can dispute that this trend and ultimate measurement indicates an absolute success in the effectiveness of the interventions in bringing about a reduction in adult mosquito populations. So if we move on to the container index, which is the percentage of water holding containers infested with mosquitoes. So it's the percentage of containers in the different villages that had mosquito larvae and pupae inside them. August 2018, Arm 1, 19, Arm 2, 21, Arm 3, 22. Again, this is a baseline survey. No significant difference between the three arms. That's exactly what you want, what you expect. So February 2019, very similar situation, not much difference between the three arms. And that was simply a reflection of it took time for the traps to be made and distributed and to show their impact. It took time to breed the fish, to distribute the fish, and for the fish to start impacting on mosquito populations. So by February, not much noticeable difference. By August 2019, percentage of 13% of containers in the households in Arm 1 were infested with mosquito larvae or pupae, 12 in Arm 2, and 29% in Arm 3. So again, a strong reduction in the presence of larvae in containers. By February this year, look at this, 4% in Arm 1, 9% in Arm 2, 35% in Arm 3. So again, a very strong, clear difference in the impact of the interventions in the two intervention arms in relation to the control arms. Strong impact by the interventions. So the house index, again based on 200 households per arm, the house index is the percentage of houses with containers infested with mosquito larvae or pupae. The percentage of houses with containers having larvae and pupae. Arm 1, August last year, 57, 52 in Arm 2, 50 in Arm 3. Again, interventions, it's baseline, no difference. Again in February, 42%, 31%, 35%. Interventions hadn't really kicked in yet. You can understand and explain that away. By August 2019, 33% in Arm 1, 32% in Arm 2, 70% in Arm 3. Again, strong supporting evidence that the interventions are doing their job. People are doing their job. People are committed. They're implementing the interventions, and it is working. Finally, in February this year, 11% in Arm 1, 24% in Arm 2, 75% in Arm 3. Undeniable, strong indication of success and impact by the interventions in the two intervention arms. The Breteau index, which is the number of containers infested with mosquito larvae per 100 houses. It's just a different way of reflecting similar data. Again, Arm 1 in August last year, 139, 106 Arm 2, 91 Arm 3. No significant difference, as you would expect. Same in February, no significant difference. And again, here in August last year, you can see a clear impact. Less than half of the households in relation to the control arm were infested. And then in February 2020, 13 versus 28 in the two intervention arms in relation to 119 in the control arm. Again, yet another way of reflecting and supporting the evidence that the interventions did work, they did work very effectively, and that the communities were sustaining their efforts and increasing the success of the interventions. Finally, the pupil index, which is another way of, again, reflecting impact. February 2019, 466, arm 2, 483, 735. Here you can see some impact starting to occur because of the interventions. August, stronger if impact, and by February 2020, 185. This is the mean number of AEDs pupae per 100 hours. In arm 1, 185, 220 in arm 2, 943 in the control arm. So multiple measures that reinforce the conclusion that the communities were fully committed, fully engaged, and very effective in implementing these interventions, and that the interventions were in fact resulting in a strong impact in vector numbers in the intervention arms. So this is just to show you that, you know, at the same time as doing the collections of adult and larval mosquitoes, the project also collected a lot of other data, such as the types of containers, pots, and so on, at the different households, the size of the containers, how much water was in there. The project recorded the types of houses, the materials used in the building of the houses, how much shade was there in the garden, all kinds of data that were recorded, very useful data supporting the interpretation of the results as well. And they're not taken up here in this report, but those data are available and will be published eventually as well. So what I should also mention, this was really gratifying to see, is the success in guppy fish uptake by the community people. In August 2018, 11% of households in the intervention villages had guppy fish, and that increased to 42% in August 2019. And look at this, 75% of households in February 2020 were placing guppy fish in containers around their households. This is really great. This is a great result to see, you know, how communities embraced the use of guppy fish, welcomed it, made use of the opportunity to collect fish from the fish breeding sites and to use it at their households. And in fact, it was so successful, it became evident that guppy fish use in the control areas was also increasing as a spillover effect as people heard of the success of these guppy fish from, you know, interactions in markets and so on with members of the intervention arms. So the message was spreading, and other people started taking up these measures, which is wonderful to see. That's exactly what one wants to see happen. So a summary of the results: the combination of simple vector control tools and strong community participation resulted in very clear reductions in all entomological indicators. So we can say very confidently that this project was a great success, that the tools were simple and effective and could easily be used by, you know, average people in an average community in an average rural area, and that they were adopted very successfully and integrated within the daily behavioral patterns of communities in those areas. The use of guppy fish was readily accepted and implemented within communities. There was very strong willingness among community members, especially women, to learn and participate in self-help vector control interventions and to learn about dengue in general. So having said all of that, this is a personal issue that I'd like to raise because of personal interest. So we did a little mini survey in August last year. So what I wanted to say is, but after all is said and done, we need to realize where the real priorities of communities lie, because this affects sustainability of continuing with the control interventions within communities. So we did this little survey in August last year where the project members went to interview people that weren't in the project area or weren't in households where the project staff were known to be involved with dengue activities. So they were unknown, they didn't mention dengue, they simply went to community members and they asked them, so we work on a project and we're trying to understand what are the problems that people in rural communities are faced with? What makes you lie awake at night and makes you worry? You know, what are your problems in life, in your community? And as you would expect, I mean, it's totally understandable. It was issues of, you know, we worry about rain for our crops to grow. We worry about disposable income to buy clothes for our children. Things like that. Dengue was only about number 4 on the list. So, and again, you can understand it. Put yourself in their position. You get dengue, you're sick for 2 weeks or so, you get over your dengue and you carry on with life. It's an episodic, once-off event, whereas chronic poverties and the consequences of poverty are with you day to day to day to day. And it's a far more intrusive long-term problem for you to worry about. So, you know, one has to take these issues into account when it comes to sustainability of the dengue control interventions that were advocated and readily taken up by communities. But, you know, if it does not last for years and years and years, one must understand what the basis of life is in these communities. So I wanted to end off this presentation by asking, or just mentioning, it would have been great if we could have related the project interventions to a reduction in dengue cases, not just a reduction in mosquitoes. Because, you know, it's one thing to show that you have tools that can bring down the average number of mosquitoes in a particular project area, and you can dramatically reduce the number of mosquitoes. But what does that mean in terms of reducing dengue infections? Have you actually brought down the number of mosquitoes enough so that it is reflected in the number of dengue cases, an equal or, you know, a measurable difference in dengue transmission? Unfortunately, budget problems prevented us from doing that. We simply didn't have the money to buy the RDT kits, etc. But it's something to keep in mind for future projects, that it would be very useful, very important to be able to relate your project success in bringing down the number of vectors to how does it actually impact on dengue incidents. Also, another aspect, would have been great if the medium and long-term sustainability of social uptake of the interventions could have been measured. And this would have required a little bit of extra money, a little bit of extra funding for once-off annual surveys in years 3 and 4, maybe longer if you could, just to see, once the project staff have withdrawn and the communities are left with those tools and they've had the training, they've given their commitments, how long do they actually persist after project end in continuing with those interventions? It would be very useful to understand that, so that you know, when does the effect start tapering off, so that maybe you can go in and do reinforcement messaging and so on. So that's all from my side. Thank you so much. Appreciate your time. Mark, I am done.
Thank you very much, Leo. It was very interesting, and thanks a lot. inspiring and very interesting. We went a bit over time. So I would suggest, and also thank you for your closing remark and observation of last August 2019. The reality is indeed often linked with poverty and with daily survival of communities or families or households. But I believe that doesn't mean the added value of working on some specific topics, be it in the health area or agriculture area or others, don't have added values. So I believe there's a daily reality of people in rural areas and urban areas, but I think it shouldn't make us less motivated to continue to strive working for dengue and other vector-borne diseases. I saw, does everybody hear me?
Yes, yeah, I can hear you.
Yeah, I can hear you.
Yeah, so thanks a lot, Leo. We have basically 30 minutes left, and I would like to use this opportunity a maximum for questions to the presenters and to other colleagues. Dr. T can answer also. The closing remarks will be minimal because I would like to dedicate majority of the time. I saw a question of Dr. Sai from the CSO platform in Bangkok. And then I saw a question of Evelyn Wong on the chat. There was a question from, or some questions from Jeffrey, and then from Dr. Yin Pang in China. So I would like to give the floor first to Dr. Sai. Can you in 30 seconds, please rephrase your question, and then we can exchange to all the answer. Thank you.
Thank you, Mark, for allowing me to repeat my questions again. Because I heard from peers saying this is a very interesting presentations looking around the intervention arms and control arms. Because I was wondering whether the arm ones comparing to the arm two, also compared to the control arm as well, how well arm one send out the effectiveness and effects over the control arm. I think Dr. Pia already answered my question as well, and also Dr. T. Chia also explained to me about the contamination wouldn't likely not occur because intervention, arm one intervention villages at least 300 meters away from the control arm as well. So I think I got my answers, and thank you very much for the opportunity for giving me this webinar, Dr. Pia and Dr. Dio as well. Thank you.
Okay, thank you, Dr. Sai. Thank you, Pierre and T, for the answers. Then let's go to Evelyn Wong. Could you briefly re-express verbally your question to the forum and then see if your questions were answered?
Thank you very much. Thanks for both the presentations. I think the first question that I have was alluded to by Dr. Brack already, which was perhaps you could explain to us a little bit as well as how tightly correlated the dengue entomological risk, so the pupil index and also the number of larvae that you find is usually correlated to dengue cases, and was this a consideration in the study that you did, or was it perhaps too much to take on within that time period and outside of the scope? And then the second and third question are basically very tightly connected and slightly out of the scope here. But based on the project, what do you think, how would you suggest the National Malaria Control Program, CNM, work with the Ministry of Education or other local actors to in dengue control, as we all know that this is a very huge issue going forward, both in terms of vector control, but also perhaps in terms of surveillance and case management. If there's any learnings that you brought from this project, we'd love to hear that. Thank you.
I would like maybe Pierre or Leo to answer the first question of Evelyn, and then Dr. T could probably answer more accurate on the articulation between the ministries in Cambodia for the specific diseases. So please, Pierre or Leo first, and then Dr. T on the second question, please.
Pierre, shall I give it a try?
Sure.
The first part
Go
of the
ahead.
question? Okay,
Ahead,
but please feel free to supplement if I miss the point. So, you know, it is a shortfall of the project, as I clearly indicated at the end, that the project wasn't designed or didn't have the budget to measure the impact of the interventions on dengue infections. You know, remember that between 70 and 80% of dengue infections are asymptomatic. So you know, you don't actually know that some people are infected, but they're out there busy infecting mosquitoes, and then of course those mosquitoes go around infecting other people. So all you have to work on are the fairly severe cases that are sick enough to go to hospitals and other medical facilities. And those cases are then recorded and taken up on the national database. And that is what is shown when a country reflects the extent of its dengue challenge. So, you know, the project didn't measure that. We did try as an exercise last year. The problem is many of the health facilities service not just a particular arm, but anybody can go there, irrespective of what experimental arm you're from. So it becomes a bit of a problem to separate out where people are from and with dengue cases. But you know, the attempts that were made by the project staff did suggest that in fact there was a noticeable impact on dengue cases as well. So that was very reassuring, but you know, I don't have sufficient confidence in those results because of the complications around separating different people that are coming to the same medical facility. But the indications were promising, strongly suggested that there was a noticeable impact on dengue cases as well. I'm not sure if T or Pierre would like to add to that.
I don't have more things to add onto the relationship between entomological indicators and disease indicators. What I can comment on is really the subsequent questions regarding, for instance, the how to suggest MOH. We work with MOE, and so in order to increase the fluidity of the dialogue and the coherence of what we have been, you know, initiating during this project is, I'm not sure, and T probably can answer that question further better. How much, you know, inter-ministerial committees there are, but that could be a way to make sure that the initiative and the work being done between local stakeholders, teachers, directors, and the Minister of Education is also incorporated into other significant ministries. I think the bridge should be established by creating perhaps committees. I don't think they are existing at the moment, but that could be something we should move forward with, perhaps. But again, T may want to complement that piece of information, as I'm less aware than he is.
Okay, T, maybe before I let you the floor for the second question of Evelyn Wong, there is also a question similar from Dr. Yin Pang in China, where in the chat box, where she basically asked, what is our experience to roll that out with health workers in the province, in the rural areas? So I think it's connected on how different ministries on national and subnational level can collaborate and can steer it all the way down to rural communities and engagement. T, can you try to summarize a question on those two participants' questions?
Okay, I'm Jin speaking. Can you hear me? Yeah. Actually, the project was designed with multiple sector cooperation with Ministry of Health, Ministry of Education, Ministry of Environment, and also include local authority under Ministry of Interior. I think, but in reality, project has been implemented only between Ministry of Health and Ministry of Education. I think they all have to play a part to make more cooperative to tackle on the issue, because this is a thank God interrelated each other, the issue of dengue. So I think the question that how would we suggest each sector, each ministry to work on dengue control, because the issue they are lack cooperation. In Cambodian, each ministry they focus on their own agenda, their own program, that the multi-cooperation between sector we become some of the issue in the country. Even right now, there is some decentralization of authority to the subnational level, but it's just starting point. It's not yet, fully implemented under the royal government of Cambodia. You see, like, look at the issue of dengue, that is they're causing by the container, water container, some of solid waste, poorly solid waste around the household, around the school, around the public road, garden. That is a very big issue that causing become the container of where that is lava or pupa can grow there. So there need it suggests strongly need cooperation within school. Right now, the Ministry of Education and the Department of School Health, they try to create the curriculum into the school intra-curriculum to teach the student. It become part of school agenda. So I think that is a great, to work that. But the other ministry, like Ministry of Environment, need to also to take action in terms of imported some of bottle, the other plastic war. So that is called the big issue for the dengue also. So in sum, that is we need a strong cooperation between ministry to work in order this dengue vector control to be success. So dealing with the question, how can we start, at the subnational level, at the field community? So at the field, we try to work together through education authority and also health education authority, cooperate with local authority, particularly the representative from women group, from community involvement, to work, through the meeting, discussion, interaction among them, so that we can prepare the plan with their involvement, so that they can implement, according their capacity, their commitment. I think that is the point I try to say. Okay, thank you. Yeah.
Thank you very much, Dr. T. Evelyn and Dr. Yin Pang, does that answer your question, please?
Yes, thank you. I think I don't want to take any more of the time, but thanks so much.
Dr. Yin Pang, are you still there? Maybe not. So let's move on to Jeffrey. I think that was the fourth person initially. I saw some questions and exchanges. So could you briefly rephrase your question for the forum and then see if your answers are satisfactory?
Okay, so there's some lingering issues about sustainability, and hearing what Pierre and Leo has just described, we have, or I have at least doubts about how this intervention can be sustained when there are disputes between households and VHWs regarding the responsibility of monitoring and maintenance those traps. Secondly, concerns about the current trap design, which is not optimal, and therefore, if it's not optimal, there are questions regarding the uptake and acceptance at the household level, despite what your data is showing about a high degree of acceptance. And thirdly, when the key containers are becoming less attractive to Aedes breeding because you're putting in guppies and you're also doing source reduction, destruction of breeding sites, one would foresee a behavioral shift in the oviposition sites towards cryptic breeding sites, which are not easily detectable or picked up by the human eye. Fourthly, and a lot of ecological activists have been complaining to some of us, particularly when we were doing the early randomized control trial of guppies and pyriproxyfen, or comparing these two interventions. So the activists were not happy with the way guppies are introduced to these jars, because there will be inadvertent and accidental introduction and contamination of the natural waterways, streams, ponds, that sort of thing. And therefore, if that is the case, they pointed out rightfully or rightly that that the natural indigenous fauna will be harmed and brought to extinction, and therefore they alert us, that this is not acceptable when you do this kind of work. Fifthly, sustainability will be affected by attrition of your educational champions, particularly the person, the senior decision maker from the education department over that ministry. And if that happens, how would the project mitigate the loss of institutional memory from the educational sector? Thank you.
Okay, thank you. Allow me, I think your second question, Jeffrey, I would like to refer it to Dr. T, because it's about household tensions and possible violence or whatever. And question 1 and question 3, let's please refer it to Dr. Leo. It's more of a debate and an exchange, I think, than rather coming up with clear-cut answers. But thank you for raising it, Jeffrey. So T, if you could briefly comment on if you see that, or you have seen that in our project, that there is this kind of tension between households concerning what Jeffrey mentioned. Thanks.
Yeah. Let's talk. Thank you, Jeffrey. Actually, this conceptual idea has designed by Jeffrey, from the beginning initiated. So I just implement at the field. Actually, in terms of threat, before we are, massive production, distribution, employment in community. So there is some assessment with testing the threat. That one time during when we starting the trap, prepare the trap, we test one time in urban area in Phnom Penh as recommended by you, Jeffrey. And second time we test when Leo come and then testing in 2 village. So I think we know that some effective of the trap, that is why we massive production and distribution of the trap. And during employment, we concern about the issue as you raised about acceptability, concerning the issue of maintenance of the threat, issue of sustainability. There it happened, somehow, because the new product, new design product, like Chair has mentioned, this is the win-win approach, like the bottle one, the one that if we threw away, we try to process and make a trap in order to reduce the mosquito population. So I think the benefit is very big in terms of environment. We support the throw away drinking water to make the trap. But still there is some issue in community. Some of the household assets and maintenance very good for long-term sustainability use for sustainable use. But other family, they not well understand about the trap, not well maintenance, because that they think the trap is not their priority. They think this is the responsibility of Malaria Consortium, responsibility of community health worker. That is happened through, maybe the shortage of communication between the health worker and also the owner of household. It happened. So that is but there is success in community. There is a huge number of households. They follow up and support can maintenance of threat. But the other group also, they are not happy with the threat because they have spent a lot of time in terms of maintenance, avoid the children playing with the threat and the other issue. That is I try to say about this threat. And the other issue you mentioned about the guppy fish, because you're afraid the guppy fish raising, so it can go into natural stream, rice wheel, so it grow, it afraid to be harmed or human. So I like to say that it is not true. Even the guppy fish can grow at some pond, because I observed that some pond it can grow very well. So people can get it to make prohok or make man. The Thai of people like to eat. Yeah, that is it happen. But mostly in the natural stream or river or pond around the community, we see that this guppy fish cannot grow because of frog, because of big fish. On the other Thai water living animal, they eat all the small one. So in some, I think that guppy fish, it is through my observation, it is not harm. It is not harm at all for community, for the country. that is based on my observation and talking and observing, you know, from the rice field and from the river. Okay, thank you. Yeah.
Thank you, T. Shortly, Leo, because we have 3 minutes left, would you have anything to add on Jeffrey's question? In 30
Yes,
seconds?
I would. No, I can't do it in 30 seconds. I need 30 minutes to answer the issues that Jeffrey raised, but let me try and be as concise as possible. Jeffrey, you and Hans are among the top experts on Aedes vector control. So if you don't have the answers to the questions you posed, I certainly am not going to be bold enough to try and answer them. You guys are the top experts. We learn from you. But my humble little opinion is that in terms of the concern about trap disputes and so on, this is just my opinion, because unfortunately the project wasn't designed in a way to tease apart the relative contribution of the 4 different tools in terms of the impact they individually had in vector reduction. So we don't know which of the 4 methods was more effective in reducing vector numbers, whether it was guppy fish or traps or waste removal and so on. But you know, you develop an intuitive sense as you go along, and it's open, you know, this is speculation. But for me, if I was forced to give an opinion, for me, the mass trapping by way of traps is a kind of an end of the line method, that mass trapping shows its impact because of failures lower down the line in larval control. So for me, you know, I'm really very pro provision of the guppy fish. Sorry, there was a question also from a lady about the cost of guppy fish, $2.75 for a pair of guppy fish. Let me just also mention that the fish were provided free of charge. That was the beauty of the project. People could be given guppy fish free of charge. So, you know, if you could ensure more or less saturation of water containers with guppy fish, which have shown themselves in multiple studies to be highly effective in bringing about dramatic reduction in Aedes larvae and pupae, you know, then the mass trapping, at least in my humble opinion, becomes less important. It's you know, the combined effect of ensuring that the main areas where they're breeding, the water containers, that those are safeguarded, supplemented by effective waste removal, empty bottles, tins, coconut husks, etc., etc., so that there are less adults emerging for the mass trapping to start off with. I take your point about you know, a shift then to less obvious breeding sites, but those would be much fewer. So in theory, at least, you know, if you remove the main breeding sites, the residual breeding sites should produce less adults. And then I'd like to move on to a serious concern that you...
Leo, 1 minute. 1 minute. I would like to give the last word to Bernadette, and then we close it up.
All right.
So,
okay, but I think you need to be a little bit flexible. But Jeffrey, your environmental concern, this is a genuine issue that donors, amongst other people, are also very concerned. So I can just mention that Malaria Consortium, we've got some seed funding from head office to run a project in Myanmar, hopefully September, but later in this year, to look for indigenous ecological equivalents of guppy fish. And they are there. Studies have been done that shown that there are small, fairly attractive fish that are also effective in larvivory that occur under natural conditions in Myanmar, wherever, in each GMS country. So we'll be going later this year to do fish surveys, try and find prospective species, and we'll be doing experiments in aquaria to look at predation rates, breeding efficiency, survival in confined conditions, exactly to address the question you are raising, to look at an indigenous potential replacement species that will not raise these environmental concerns. Okay, I've run out of my minute. I was going to address other questions for you, Jeffrey, but I've run out of time, it seems. Thank you, Mark.
Thank you, Leo. And it's interesting, but sorry, time doesn't. I think this seminar is also a good opportunity to connect and to exchange further later on in groups. And I think that's one of the purposes why we did it. There's not much closing remarks from myself, but I would like to go back, except if there are any burning questions unanswered. Please let us know if there is any.
So Mark, I think regarding sustainability question raised by Jeffrey, I mean, is totally right, but just want to say that Rome hasn't been built in one day, right? So we are establishing a step, we are moving forward as much as we can. So hence the importance of following up on those projects. But I'm happy to talk to Jeffrey and others, separately. So I just wanted to add that I have some answers to those questions.
Thanks, Pierre. And I agree with you. I think it's not work done in 2 years. I think it requires engagement. And if Mo is still around, Mo from California, Mo Sami, she used to tell me in Bangkok in November, if you engage, it ends up in a wedding. So engagement means a commitment to go further than something. And I think that's something that I remembered from the Bangkok uptake meeting. I don't know more if you're still there. So I think that's something we should also keep in mind. Engagement is not possible if you are dancing on grants and contracts. Engagement is engaging and ending up in wedding with the community. So I like that idea. So let's have the final word from Dr. Bernadette, if you're still around, and yeah, and then we close it up, please.
Oh, thanks very much. First off, I'd be very, very brief because I know we're running out of time. But thanks for this opportunity. This is a very good timing to see the work and the fruits of all the labor that has started a few years back, and especially also acknowledging the initial participation of Jeffrey, which was very significant as well. I'd like to thank very much the hard work that had been put by the investigators, the co-partners, and all the people that had collaborated in this project. But particularly greatest appreciation for the community that had been part of the solution. It used to be that much of the interventions as far as health the concerns are involved, it's usually a top-down approach, and the attraction of the work that had been supported by WHO TDR is because this work is actually trying to marry a top-down approach together with a more of a bottoms-up, where the community itself is engaged and the community itself is participating in finding solutions to their own problems. I agree. There's never enough money. There's never enough funding to cover what we all want to do. The way TDR works is we provide the seed funds so that we can start off. We are taken to a good start so that we can proceed and try to understand the situation, and from there try to build on what we have and try to seek more partners towards sustainability. It would have been great if we were able to show impact on dengue itself. But of course, we can always also observe data in an indirect way. If we can look at dengue surveillance, you have your community leaders there looking at epidemiological mapping as well, trying to see whether in an indirect way, if there's any impact on diseases and dengue in the community itself. So there's other ways in which you can continue with the work. One of the issues that had been raised, and in fact, WHO had been sensitive to that even from the beginning, and we've had major conversations. I've had major conversations about that with Jeffrey. It's about predator species like guppies, and if ever they get into the ecology, and in fact which are not indigenous. I think in addition to the forward studies that Leo and his group are going to engage with in Myanmar, you might also want to understand whether the guppies had already been indigenous in a sense, in quote unquote in quotation marks. What I mean is that guppies had been there for so many years now, for more than several decades, and then in fact they could be considered native in a sense, and already part of the cycle, the web of life in a certain ecology. So you might want to see whether how guppies have impacted and have taken over the natural fauna, if and try to understand if there's any serious concerns about the use of guppies in the communities. But having said that, I really am very pleased. As a child, I've had dengue, and it was very severe. And this project is very near and dear to my heart. As a child as well, I've raised guppies in a fish tank, and so this for me is a very special project. But at the same time, because it is a project that's rooted in communities, this makes it also more special. So with those parting words, I'd like to really congratulate everyone. Looking forward to reading all the publications that are going to come out of the project. But at the same time, I congratulate everyone for the uptake of the work, the uptake by the communities, the uptake by the ministry partners, the uptake by co-researchers as well. Congratulations, everyone. Thanks.
Thank you, Dr. Bernadette. Very nice. Thank you to all the team. Thanks to all the participants, and thanks to National Program. Thanks to all the stakeholders, to all the technical partners that made this project workable, and thanks a lot. Yeah. Have a good night, have a good day, have a good afternoon. Thanks a lot.
Thank you, everyone.
See you later.
Thank you. Thanks, everyone. Bye.
Bye.
Bye-bye now. Bye-bye.